Why are there not more people talking about easy ways to beat the stomach flu? First up, hydration is key. Drink clear fluids like water or broth, and consider oral rehydration solutions to replace lost electrolytes. Next, ease back into eating with bland foods like rice, bananas, and crackers. Avoid fatty, spicy, or dairy-rich stuff. Your stomach will thank you. If nausea or diarrhea is severe, medications might help, but always consult a doctor first. When taking medication, follow the dosage instructions carefully. For Loperamide, the initial dose is usually 4 mg, followed by 2 mg after each loose stool, not exceeding 16 mg per day. For anti-nausea medications like dimenhydrinate, the typical adult dose is 50 to 100 mg every 4 to 6 hours, not exceeding 400 mg per day. Most cases of stomach flu are viral and resolve on their own, so rest up and take it easy. Remember, hygiene is your best friend. Wash those hands often. And if symptoms persist or worsen, seek medical attention. Stay hydrated, stay rested, and you'll be back on your feet in no time. Happy healing.